welcome to Brain, Music and Learning podcast, Kaisa-Mari Kostilainen.
Thank you.
Wonderful to have you again with us. And this time we are planning now to talk about your recent research. Not so many results yet, but a very interesting project. So again, you are working at the hospital with babies, but this time the babies are not so well.
Yes. So this is like my postdoc study that we are starting now. It's been conducted like in collaboration with the Helsinki University Hospital, and again we are in the neonatal ward, but now we are not studying premature infants, but we are studying full-term infants that are suffering from neonatal abstinence syndrome, and that means that their mothers have been using drugs during pregnancy, and then these babies can have withdrawal symptoms after birth.
And what does it practically look like?
Well, of course, depending on what kind of drugs the mother has been using and what amount and for how long, it varies a lot between the infants. But normally the withdrawal symptoms, if they start like 2 or 3 days after birth, and these children are really sick. It's really like heartbreaking to look at them. They are really restless and tearful and crying a lot, and they can have like tremors and they can be vomiting, and they can get really sick. And basically, if the symptoms get really bad, they will give them morphine as a treatment.
So it's a very severe condition in the worst case.
Yes, yeah.
And how long do they last?
It depends a lot. It's like it depends mostly like what kind of drugs the mother has been using and how long and how much. So it's like every baby is different. So there's nothing, you just have to like wait and see like when it gets easier. But of course, if they get the morphine, then they are going to be at the hospital anyway for some time, because then they have to cut the medication like step by step.
So these babies, they get this medical help, but also music therapy could help them.
Yes. So, well, I'm not talking about this as maybe music therapy, because I would like to, the idea in this is to create like an intervention that would be non-medical, that we are trying to help to ease the withdrawal symptoms like non-medically. And the idea would be that we create this kind of multisensory intervention. So that would include like holding the baby and rocking the baby and singing to the baby. So I want to have the singing effect there, because we know how the premature infants have been reacting to that, and also looking at the baby if the baby is awake. So in a way, like trying to calm the baby down during via like various sensory channels. So that is like the idea. We haven't yet started the study, so some things can change, of course, still, but that is like the idea that we have for that.
And this is partially also inspired by the studies in adults, which are showing that pain relief can be, music can be pain relieving in certain situations for adults. So it would be possibly that also for the infants?
Yes, and actually there are some studies also done with preterm infants, that if there is music therapy or parents singing, it can also relieve pain in preterm infants.
And some of this pain relief in adults is connected to attention. So there are theories saying that pain actually requires you to attend to the pain. And if you have something else to attend to, like music, it's like a magnet for attention. So it's really capturing the attention of the infant. So that might then help the infant to actually not attend to the pain so much, but attend more to the music.
Exactly. Yeah, that's true. And as we know that the withdrawal symptoms are coming from the central nervous system and from the autonomous nervous system. So I was thinking that if this kind of intervention could calm those down, it could maybe ease the withdrawal symptoms also.
So that sounds like an amazing plan. I hope it really works.
Yeah.
You also work with the parents.
In this study, you
Yes.
mean? Yeah. Well, the idea is that, well, with these children, of course, the parents can have like several problems, and it's not so that the parents are always there with the infants. But the plan is that if there are parents that are really like motivated to be there with their child and to get their life more together and not use drugs, it would be really nice if we could have like some sort of also music therapy sessions with these families to see if this kind of family-centered music therapy could benefit these families, like if it could improve interaction and emotional connection and these things that we were talking earlier with the singing kangaroo study.
Yes.
Yeah.
So practically, some of the mothers, they just come to the hospital, give birth to their child, and leave.
Yes,
so it's
that
really
can
hard.
happen.
It's
Yes.
really hard to make a connection with them. But
Yes, yeah.
some of them might need a lot of medical attention, so they might need help with different types of medical conditions, and that might also motivate them to stay in the hospital if they are getting help there.
Yes, and quite often these opioid dependent, like pregnant women, are already like in this medication assisted therapy, so they are treated already before they give birth. So the plan is that if there are these kind of families that are already treated and they want to change their lives, so then with these families we could also offer this kind of music therapy sessions and see if it would benefit them. Because actually, like this target group hasn't been studied, like really, like not much. So we really think that this is really important. And we know that, of course, like luckily we don't have these infants coming to the hospital so often, and that's of course like a really good thing. But for the data collection, it will be maybe slow, and we are not going to get so many infants. But I think that even though we wouldn't get so many infants, it's anyway important to do this study, and maybe some other research group will get excited and do something bigger if they have like many hospitals, for example in America, when there's like a lot of this kind of problematic with the opioids, in infants born a lot with this like this syndrome. So it would be amazing if someone else would do a bigger study then.
It's quite different from Finland.
It
of course.
It is.
When a woman who is abusing substances becomes pregnant, so that can actually be a very big turning point and a motivator for her to change her life and change her habits and so on. So that's also something that you are waiting for, meeting these parents and offering maybe help for this kind of big lifestyle change.
Exactly. So the aim is that if there are these kind of families that are really in that point that they want to have support and they want to have like take care of their child and not use drugs anymore, it's really important actually to offer the support in this early stage. And this like non-critical support I have to add still, because it's really important for them that you are not like criticizing their like things, because of course the baby is really sick and the mothers can have like a lot of guilt about the situation. So still that you are with them as you would be with any other family. Like working. So you are meeting these mothers as mothers. Yeah, exactly.
Yeah, that's amazing.
Yeah.
I'm hoping all the best for this project.
Thank you.
And hoping to get some results also.
Yes, me too. Me too. Thank you.
Thank you so much, Kaisa-Mari.
Thank you.